Welcome! In this short video, we will demonstrate 6 basic eye physical exam maneuvers. Knowing how to do these maneuvers is important for your physical diagnosis course, your time on the wards, and for passing your Step 2 clinical skills exam. Not to mention, this is the basic eye exam that should be done on any patient presenting to their primary care physician for a physical. Let's get started. The first step in examining a patient's eyes is getting their visual acuity. Visual acuity is measured one eye at a time by using an occluder and having the patient stand 20 feet away from a Snellen chart, reading off the letters one at a time. If the patient normally wears glasses for distance, they should wear them during testing. If the patient is unable to achieve 20/20 vision in one eye, you should put down the pinhole on the occluder and see if that helps. If you are in an office or medical setting where a Snellen chart is not available, you can use a near card to get an estimate of the patient's visual acuity. Record the results with either an SC, meaning without glasses, or a CC, meaning with glasses.
Next, we are going to examine the patient's pupils. Using a pen light or muscle light, measure the diameter of both the patient's pupils in dim and bright light. The pupils should be equal, round, and reactive to light. Check the direct and consensual response to light by shining light in either eye. Check for pupillary constriction to accommodation by having the patient focus on a far object, then quickly to a near object and observing. Finally, with dim lights, using the swinging flashlight test to check for APD or a relative afferent pupillary defect. Next, we need to check the patient's extraocular movements. There are 3 cranial nerves that control the muscles for eye movement. Cranial nerves 3, 4, and 6. We can test their functioning by standing roughly 2 to 3 feet from the patient and having the patient follow your finger with their eyes. Hold out your hand with one finger up, instructing the patient to follow your finger with their eyes only, and keeping their head still. Start in the midline and draw the cardinal H in the air.
The most important part of performing a confrontational visual field exam is patient and examiner positioning and providing the patient with simple and concise directions. First, have the patient remove their glasses if they are wearing any, as glasses can create artificial field defects on exam. Both the patient and the examiner should be seated with their knees almost touching and their heads at equal heights. Positioning is important because you will basically be checking your own visual field against that of the patient, and if the 2 visual fields are not lined up symmetrically, the test is not accurate. Tell the patient to look at your nose and ask if any part of your face is missing. Next, hold both of your hands up on either side of the patient's face, making sure your hands are equidistant between yourself and the patient. Tell the patient to look at your nose and ask how many hands they see. Finally, ask the patient to cover their right eye while you close your left eye. Instruct the patient to continue to stare at your nose while you proceed to hold up 1, 2, or 5 fingers in each of the 4 quadrants of their visual field, asking them how many fingers they see. If the patient's eyes start to wander around, simply instruct them to keep staring at your nose and repeat the exam for that quadrant. Repeat this procedure for the other eye as well. The retina exam is best done after giving the patient dilating eye drops. However, these drops are not always available in the primary care or emergency setting. If they aren't available, it is important to do the exam with the room lights turned off or dimmed so as to avoid pupillary constriction, which would make the exam more difficult. First, have the patient remove their glasses if they are wearing any. You should also remove your own glasses. To check the patient's red reflex, dial the focus on the ophthalmoscope to 0 and stand roughly arm lengths away. Looking through the ophthalmoscope, swing the light source back and forth between the patient's eyes to compare the red reflex. Next, we will demonstrate how to examine the patient's retina. When examining the patient's left eye, hold the ophthalmoscope in your left hand and use your own left eye. The opposite should be done with the patient's right eye. Adjust the size of the light source accordingly. Instruct the patient to focus on an object across the room. Starting slightly temporally and about a foot from the patient's face, slowly move in, keeping the red reflex in view. You should end up pretty close to the patient's face, roughly a few inches. Start by looking for the optic disc, which is slightly nasal on the retina. If you are having trouble finding the disc, locate a blood vessel and trace it back until you find the disc. Next, examine the peripheral retina. Finally, examine the macula, or the center of vision. This should be done by instructing the patient to look directly into the light, and should be done last because it can be irritating to the patient.
Thank you for spending a couple minutes with us. You can accomplish a lot by carefully examining your patient and asking screening questions during the exam. Enjoy practicing.
Go Team Vision!